Hey everybody, welcome to the Dr. Jason West patient success story. And this one is great. In a minute, you're going to meet Lilly and her husband Craig and hear Lily's story and how she beat her disease and became someone different. And it's so motivating and inspiring, and it's such a special story for me because everybody is writing their life story. Everybody's got this journal. Everybody's got this pathway that they're doing, and you don't always have to live that pathway. And every once in a while, people will say, wait a minute, I'm not happy with the story. I'm going to change the ending. And that's what Lilly did. This is why it's just great. And so Lilly came struggling with some fatigue and some depression and some chronic infection markers. And we helped her to understand it's about balance and about rules and how to put order and structure into your system. Because the reason why people come into the office when they go see a doctor, because they say, I don't like how I feel. I've lost control of my physiology, or my stomach doesn't work right, or I have headaches, or I'm tired all the time, my muscles hurt, all these chronic pathways. And when you restore balance, this is the outcomes that you get. Now, after you see Lily's story, what I'm excited to share with you is some tools and resources so that you can write your own story. Whether you're across the street or across the country, there's a way to get order and balance back in the system. Some of it is what you do at home. Some of it is some advanced therapies. And some of it is just being aware that you can write your own ending. And so I'm excited for people to be empowered. And so let's go through Lily's story, and then I'll share with you what we did after that. Check it out. Hey everyone, it's Dr. J and Lily and Nate here talking about some experience and stuff in the office. And as Lily was telling me her story, I'm like, this would be awesome to share with other people, to give them some hope on chronic health problems, because so many times people are like round pegs that we're trying to stuff in square holes in the medical system. That was kind of Lily's story. So Lily, we've hooked up how long ago?
A year ago.
Just over a year ago.
Yeah. So just about a year ago. And you originally came in the presentation, how did you feel? Not your diagnosis, but how did you feel when you came in?
I was tired constantly. Didn't matter how much sleep I got. It didn't matter what I did. Nothing would help that. I had severe joint pain. I was constantly dealing with some kind of wrist pain or back pain. Had terrible stomach issues. I basically couldn't eat anything without having some sort of stomach upset, and it got to the point where the last couple weeks before I came to the clinic, I hardly ate anything because it was just too upsetting for my body.
Okay, so Nate, when you guys came in, you're engaged, you're spending a lot of time with her. Your observation of how Lily was when we first started treatment was what?
Very similar to my brother Wes, who you've helped out. He has Lyme disease as well, and it was just super similar to his experience.
So bad stomach, pain somewhere all the time, a lot of time in your wrist, not able to recover from usually when people go to bed and they wake up, they feel like I'm a little bit refreshed, but you would wake up and you're like, no, I can just sleep all the time.
Mm-hmm.
Yeah, emotionally,
and
super highs and super lows all the time.
Brain fog.
So Lily, with that being said, the medical diagnosis before I started work with you, I know one thing is they're like, oh, it's in your head, let's just give you a happy pill. So they gave you some antidepressants and stuff, which you're going to talk about. But was there a medical diagnosis besides depression when you first came in?
No, depression and anxiety, and that was it. I had never received any kind of diagnosis or end all or anything to give me any kind of answers really to my
So there was no diagnosis, and there was no plan either other than here, take this antidepressant and you're going to be fine.
Yeah, no, my mom and I for the last several years, we had gone to doctors for specific symptoms that I had been having, but we never could find something that tied it all together, and it just was really frustrating to feel like that.
All right, now we connected because I was taking care of Nate's brother that had some similar conditions, and we started 15 months ago or 18 months ago, so that was beginning of 2019, and the diagnosis that we gave you was what?
Lyme disease.
So we have Lyme disease. Now, Lyme disease is the great imitator. It's a bacteria that literally attaches the weakest link. I mean, there's a really neat paper in the British Journal of Medical Practitioners that says Lyme disease can cause neurobehavior, neurodegeneration, psychiatric, autoimmune, and fatiguing illness. Like if it just, and you put 40 people into a room and there's going to be 40 different conditions. Some people are going to have muscle pain, a lot of emotional components. Almost all people have a rough stomach or they just can't really get stuff into their system. And then we outlined a treatment program. And tell me a little bit about what was in the program.
So Dr. J had outlined a very strict program for a couple months of IV treatment, red light therapy, emotional therapies, RTMS, some acupuncture. We had done detoxes. We had done neural therapy. That was a huge thing in the program. And it was just very like all over the place, and it just helped everything.
So, and then we had a whole bunch, like we did some work, but you did a ton of work too. Like, and I'm really proud of you for doing that, because we took you from not being structured to some structure. And it was kind of rough to get there. But when I say that to people, tell everybody what that means. Like when we gave you structure, what did you have to do on your side to line up for the treatments?
I had to put myself on a very strict schedule for home life. When I left the clinic, I had to be eating a certain way, and at certain times during the day I had to be taking supplements, and the biggest thing for me was my bedtime. I had to go to bed before around 10 every single night, which was a huge sacrifice for me because I loved staying up late. That, as someone with Lyme, I've learned that they like to usually stay up really late, and I think it's just because our sleep is terrible, and I couldn't fall asleep quickly, and it was something that I had to really train my body to do. It took a lot of time and energy to get myself to a place where I could fall asleep at a reasonable time and get up at a certain time.
Now, Nate, chime in here, because you and I talked about this, and it's when people have a schedule, they respond better. So she's saying this really strict thing. I almost feel like I put her in prison.
No.
I didn't do it. Like I just said, I want you to go to bed. Yeah. I want you to go to bed at the same time. I want you to get up at the same time, and I want you to eat consistently. You know, to Lily, she's like, oh my gosh, that's so much structure. But Nate really helped. So like, I wanted to give props to Nate and Lily, because when you when you want to put control back for people. So when Lily came in, this is what she was telling me: I've lost my health, and I'm out of control, and I want it back. Now, she didn't say that in those words, but that's what the message is of I've lost control. So when we started to put control in, we had all of this like years and years of being like, well, I'll go to sleep when I'm tired and I stay up all night. And with Lyme disease, it's so common for people to turn into vampires. And I'm joking when I say this, but it's like they can't go to bed at night and they can't get up during the day. And I think it's because the bacteria, this is my own theory, it gets in, it messes up with the pineal gland and the melatonin pathways, and so it's hard for you to get. But Nate, like, you were a huge part of this process. So walk us through putting structure and control back in Lily's life, because this wasn't easy.
No, it wasn't. It was probably the most difficult thing. Getting the shots and the IV treatment was the easy part for Lily. But it wasn't until, like, it took her probably a month before she really got on board with being committed to a schedule. And it was really at that point that I saw, like, it was the turning point when, you know, we had probably 2 weeks into her being super steady on going to bed at a certain time, getting up, eating consistently and eating healthy, that her body was able to respond fully to the treatments. And like, there was follow through in how she responded and her overall getting control over her health.
So you guys, I love this part of it, because the goal in the office is to help people, to empower them so that they make decisions that, and Lily didn't know. Like, before, when we were working with her, she's like, well, I'm just following what my body's telling me, which is I go to bed when I'm tired, and I eat when I feel like it. And I'm like, I get it. Like, I know why you're like that. But in order for you to get your life back, we got to put some structure in there. And Lily, the most important thing about the testimony, I didn't even ask. Like, you felt horrible 18 months ago or 15 months ago, where you're in pain, your stomach's a mess, brain fog, and now, like, how do you feel now?
It really has been a complete 180 in my life, and the people around me just say, Lily, I don't think I've ever seen you this happy. I've never experienced you this happy before, and it's been something that I feel like I can have some control over in my life. Like I feel like I can live my life to the fullest in the way that I have always wanted to live my life, and I don't feel like everything's gonna fall apart if it goes wrong. You know, I just feel like there is some stability and a way out and a way to get to where I really, really want to be.
So what's fascinating about that, I was just talking to one of my team members before, and she was saying, well, what about emotional health and physical health? And I'm like, they go like this. And so when she's saying, hey, people around me are saying I'm so much happier because physically, like, you're feeling better for probably the first time ever, right?
Yeah.
So that being said, you're happy, but how do you feel physically?
Physically, it's been, like I said, night and day difference. It's been like I have energy. I can wake up in the morning. I feel happy to wake up in the morning. Like I feel like my life is just right where I want it to be, and only going up from here. My joints are so much better. I can do yoga for 30 minutes without having to ice my hands after. I feel like I can eat, and I eat well, and I crave certain foods that I didn't crave before. That like just my body is just in alignment now. It's been so incredible.
Now I want to go back to the treatments a little bit because so one, like she and they made the commitment to put structure back in their life, and people sometimes are like, are you going to tell me this again? I'm like, look, do the basics. Go to bed at the same time, get up at the same time, eat healthy and alive foods, healthy relationships, having time for you, like making sure that people don't take and add to your plate of problems their problems. Like we walked all through that, and Lily's like, hey, I got it. Now it took a little bit of time for her to like get it, but she told me she got it. But that being said, we don't do an anti-inflammatory, antibiotic, steroid approach. We just don't do that because we want to build up the body. So we did vitamin infusion treatments, and then we say it all the time, but the neural therapy is so important. So tell everybody, like, what is neural therapy, and what was your experience with that?
So what I understand neural to be is a resetting of the nerves. You can correct me if I'm wrong. And it was just these shots. I don't even know. Can you tell me like specifically what's in them? Or?
So it's a B vitamin, and what it does is it makes your nerve endings open, close, and reset. And it's not always the funnest thing to do.
Yeah. So the first couple weeks of treatment, I had neural every single day in different parts of my body and my stomach the first week. And literally within that week, I was back to eating healthy and eating normal, and my stomach could handle it. It was so incredible to feel that. My lungs, my heart, we've done my spleen, my liver, you just get it everywhere. And my brain, that's been a huge, incredible source for my brain fog to be lifted and just be so impacted for good. And
so with chronic health problems, it's so common for the body to get a nerve memory where it keeps your body here. So your mind's telling you, I want to live here, and you're surviving here, and then the body's like, well, I'm just supposed to be sick. Like it forgets what it's like to be healthy, and the neural therapy wakes it up and resets it, just like rebooting a computer. If we're having computer problems, call up tech support. Tech support's going to say turn everything off, turn back on. That's what neural therapy does. So we did that, and then we did the other treatments, red bed. RTMS stands for rapid transcranial magnetic therapy or stimulation therapy. It's a way to kind of massage your brain. We got you on a good supplement program. You're feeling literally 180 degrees better. And Nate, you've been able to see like all of a sudden someone completely shift.
Oh my gosh, yeah. If I could just like make a movie of who Lily was before and how she felt and what I could witness versus now, it's miraculous. Like I have Lily. I don't have, some sort of sickness that is holding her back. Like she's got the reins on her life now, and it's really been one of the greatest gifts to our relationship.
So you guys, this is such a cool story of someone that was out of control. She was sick and out of control, didn't know what it was, put some structure in there, gave her the treatments to build her up, reset the nerves, massage the nervous system. The red light therapy is a way to get ATP or energy into the body, get her on her specific nutritional program to give her the most important vitamin, which is the vitamin that she needs. And so when she talks about a very strict supplement program, it's like we do tests and then we give stuff based upon those tests. And sometimes it's vitamin C, and sometimes it's B12, and sometimes it's folic acid, and sometimes it's something different like ammonium molybdenate or boron or zinc. Anyway, there's all these different things. So Lilly, it's been super fun to work with you, because at first it was like I knew we could help if she made the commitment, and she totally did. So like, you know, she did 90% of the work. We just kind of nudged her in that direction. A couple things. One is, if people are watching this with the chronic health thing, what would your advice, suggestion, recommendations be?
That's easy. Get here.
Yeah.
Like it'll
Really.
be the smartest decision that you ever make for your health and for the people around you.
And Lilly, if they can't get here, as far as like just lifestyle. So of course we want people to help people, and again, we can customize treatments that it'll blow your mind when you get here, and we tailor medicine for you. But if they can't get here, just some takeaways, because this has been such a awesome thing to see. How would you recommend people to take control?
I would say first, if you feel like something's wrong, like check it out. Don't sit on it. Don't wait. Don't blow it off. Like, trust yourself, because for a long time I just thought that's how life was, and it's not. Life is so much better than you could ever think it is. And secondly, trust the people around you. If they're looking to see that something's wrong and they want to take care of you, I would say trust them, and they have your best interest at heart, and just have faith.
So you guys, this is Dr. West, Lilly, and Nate at the office. Nate, any last minute takeaways for anybody watching this that's sick or has a loved one that's sick? I mean, because you're pretty healthy, right?
Yeah.
And so you're looking at the sideline saying, look, what would your advice as an inner circle member be to someone looking at, man, my sister, my wife, my cousin, my best friend is sick? What would you tell them?
Yeah, I'd just say what I just said. Like, get here. Like, create yourself like in some sort of conversation with the West Clinic. They will look to serve you, and they'll create some sort of opening that will provide some further light around what, getting that person healthy could look like. I'd say coupled with that, I had no idea how important structure is in a person's life. Like, Lilly would not be where she is if she didn't buckle down to a schedule, and her food, like what she put in her mouth, makes all the difference. And I would say, if you can't get here, then be disciplined in a schedule and eat the right foods at the right times, and be disciplined with what you put in your mouth.
And it's so fun to help people understand that, because it's so misunderstood and underrated, of just saying, look, let's just get control back in your system. And sometimes people will be like, no, like, I want the magic treatment, magic formula. That's it. Anyway, I don't want to beat a dead horse on that. Now, it's really important, for the reason I asked you to do the interview, I want to share the message of hope and getting that back to people. Is it okay if I share this with my patient base and their social media platform?
Yeah, of
All
course.
right. So you guys, if you need anything, it's westcliniconline.com. And we're on Facebook, we're on YouTube, and you're not your diagnosis. That's the other thing I told Lilly multiple times. Like, you're not a person you're a person, but you're not a depressive patient, you're not a pain patient, like you're Lilly. And that's how it is. And so you want to make sure that you treat people individually, and these are the kind of outcomes that we see all the time. And we'll see you guys on the next video.
Okay, guys, so that's Lily's story. It was so fun to have her and Nate in the office and talking about what we can do to put the body back in balance. So we follow the protocol on my friend's book, Dr. Tom Levy, Curing the Incurable. We used the Atlas and the Manual of Neural Therapy to reset the nerves. We did mind-body treatments, but most importantly is Lilly decided, I want to be on a different pathway. And so a big shout out to her, and what a neat support structure that she has with her husband, Nate. It's just fun to see those guys make it in the world. So with that being said, you guys, I wanted to give you some resources available if you need some help. If you're across the street or across the country, here's how you can get some assistance from our office, our team at the West Clinic. So first of all, head over to drjasonwest.live. This is what the website looks like. It's right behind me. You can see there's a welcome video and a bonus resources. And of course, my computer over there crashes. So I'm not going to be able to show you the next thing, but I'm going to be able to share with you this. When you fill in your information, you can see what is happening, and you can see everybody's story. You can download the book, you can get the ebooks, you can see the stories on Lyme disease and sinus problems, and Jerry's story about beating arthritis, and Patty's story about beating psoriasis, and Jessica's story about beating Epstein-Barr. Like, there's so many different stories. There's literally hundreds of them. And we do a free master class every week. The one that we're doing this week, starting on Wednesday, which is going to be October 27th, we're going to be doing the chronic fatigue process and how you can do things that are really going to help your ability to beat the energy suckers in life. And I'm going to show you, there's some simple blood tests that you can do that almost all doctors do, but they don't interpret them to see what's happening with the immune system and the white blood cell count. So that's all over on drjasonwest.live. We have so many resources over there. There's also a way that we can help you, whether you're across the street or across the country, to get help. And we design protocols for people. We can help them outside the office. We can help them inside of the office, and then there's stuff we can do in between. So that's our patient success story. So happy that we're able to share this. We'll see you guys next week in our masterclass on chronic fatigue, and then next Thursday there's always a patient success story. I'm Dr. Jason West, and here is to your energy, balance, and longevity.